Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull all the way down. So let's take a moment together to ponder how can craniosacral therapy help with the diagnosis of scoliosis. So in taking a review of craniosacral therapy, we know that the craniosacral system involves the meninges, or the membranes of the head, all the way down, continuous with the membrane sac holding the spinal cord. When we have a scoliosis, we in fact have a three-dimensional twist in the spine. It's depicted in pictures and in x-rays as being an S-curve. But in reality, when you look at it three-dimensionally, it's actually a twist, a rotation in the vertebra. So, what in the world causes scoliosis? Well, several causative factors that can be explained and helped by craniosacral therapy in general. All right? So, we've already in a previous topic talked about orthodontia. And we've talked about the fact that in putting braces on teeth, particularly the maxilla, because this upper jawbone or maxilla is two different bones that, once again, to review with the craniosacral system, they're widening and narrowing, about 8 to 10 cycles per minute. So it's a very slow rate. But if we go ahead and we have the bracket on one side, before we get to the other side, if the other side has moved out of the expansion phase and into the narrowing phase, we can have a scenario that then has those bones looking like this, out of sync. So one's expanded and one is narrowed. That can induce a twist through the membrane system, and I'll refer you back over here to the poster. Membrane system, intracranial membranes, meninges, membrane sac holding spinal cord, that can induce that three-dimensional twist that we talked about all the way through the body. That seems very logical in terms of what we know of craniosacral therapy, how to address that. We address it from inside out, from the membrane system. In the spine, from deep inside the bone. Each of the vertebra has a hole in it, the foramina. Okay? So within that hole, if there is a rotation of the bone, a chiropractor will think of it in terms of adjusting from the bone. We think in terms of adjusting from inside the bone, because that's where that membrane sac holding the spinal cord goes. So whether it is from orthodontia, that's one of the factors. Sometimes there's a hereditary factor. You'll see it mom, you'll see it child. Sometimes it has to do with baby's position as they're developing in utero. So was there a bit of a twist induced because of the position of the womb, the position of the uterus with its suspensory ligaments? Was there a twist induced as baby was being delivered? Was there any force that had to be given in order to help baby crown and go through the birth canal? Or, in fact, is it from a situation like low muscle tone? When we have low muscle tone, which oftentimes is not observed by parents so much, that's usually picked up on sometimes by a pediatrician, more often than not by the OT or the PT, when the child is exhibiting a lag in their motor skills. Or you'll see a posture that looks like a slouch, or parents will report, you know, Johnny gets tired so easily. He tires much more easily than his brother did when he was his age. That kind of thing. Or maybe it's a situation where a baby fatigues very quickly in trying to eat, in trying to nurse. Or a child has difficulty wanting to chew things. They would much prefer their carrots cooked or mashed or cooked and included in something else rather than eating them raw, because it takes a lot of energy and muscle to do that. So muscle tone, low muscle tone, is another reason for scoliosis. Whatever the causative factor is, craniosacral therapy is an important part of the team in terms of helping that child get better with the scoliosis. Why? Because we're addressing from the inside, all the way from the inside out. And how do we do that? Dr. Upledger described it as flossing the dural tube. What in the world is he talking about there? Well, it's simply this. I'll use my model George again. This is the base of the skull. So we're looking at this bone. We're looking at that bone being right here. And so the individual, if we have one hand here and one hand cradling the other end of the spine, the sacrum, we can feel what that twist is. And we can help find, locate through our touch or our palpation skills exactly where the twist is to begin to release it from the inside. Now, I will say that craniosacral therapy, when it comes to scoliosis, is not the end. It's not the end-all and the be-all. We are very complex beings. So That being said, we need a team. We need a team of people. We need a therapist for that child who knows how to do perhaps some physical therapy, some specific muscle exercises, because what happens when you have that three-dimensional twist, you can imagine. I'll demonstrate just slightly. If I have a twist that pulls me over so I look like this, obviously the muscles over here have stretched out, yes? And the muscles over here have shortened, yes? So we need help not only working and changing it from the inside, but we need an exercise program. Someone to show that child what to do, or that parent, maybe I'm speaking to you as a parent, how to help that individual, help that child. Could be a young child, could be an older child. How to help them do those kinds of exercises that begin to strengthen the overstretched muscles. It begins to loosen the tightened muscles. And it's very important to address, if we look at the muscles of the body, and you might want to look that up. Netter Anatomy is a good source. There are many online resources for looking up muscle anatomy. But you'll see that under the muscles that we think about most often, that you hear about all the time, for example, in sports medicine, things like your lats and your traps and your obliques. Those are words that are pretty common knowledge to the average population that keeps themselves fit. Okay? We're talking about little muscles that run right along the spine. The erector spinae are some of those muscles. Okay? Those are the muscles that have to be strengthened, because the outer layer of muscles are the compensators. And that's what we all do. We compensate. So when we have a twist, we're going to compensate with those big, strong outside muscles. It's the weak ones on the inside that need the help. So we start out with craniosacral. We keep working with craniosacral, because as those muscles begin to change, we have a large role to play in terms of helping the nervous system and helping that membrane system on the inside to relax and release, while the individual is also exercising at home, doing their own home program. We have a very key role to play in preventing scoliosis and in helping scoliosis as well.